All right, everyone get ready, because today we're going deep on hysterectomies.
Ooh, yeah.
This surgery might seem pretty simple at first,
Hmm?
but, the more you learn about it, the more you start to see just how much there is to think about.
Absolutely.
But we're here to give you the info you need
Right.
so you can feel good about making decisions about your health and really taking charge.
That's exactly it. It's all about having all of the options and knowing the little things, the nuances, and then the impacts, right?
Yeah,
So that you can really be involved in your own health journey.
exactly.
Yeah.
Okay, so first things first.
Okay.
What are we even talking about when we say hysterectomy?
Okay. So a hysterectomy is when they surgically remove the uterus.
Okay.
And one of the biggest things to remember is that this means that you can get pregnant after you have the procedure.
Got it.
So for anyone who still wants to have kids, this is a really big decision.
Yeah, that's a big one right away. And I'm guessing there's not just one kind of a hysterectomy.
Sure.
Is that the one-size-fits-all thing?
Yeah, you're right. There are actually three main ways that they do a hysterectomy.
Okay.
There's the open surgery,
Okay.
where they make a bigger cut in the abdomen.
Mm-hmm.
Then there are minimally invasive options,
I think-
like laparoscopic and robot-assisted.
Right.
They use smaller incisions for those, and then long special instruments.
Good.
And then lastly, there's a vaginal hysterectomy,
Okay.
and that's where they take the uterus out through an incision in the vagina.
I bet the recovery time is totally different depending on what type you're talking about.
Oh, for sure. The minimally invasive and the vaginal hysterectomies usually mean a much faster recovery
Okay.
compared to that open surgery.
Mm-hmm.
But the best way to do it for each person really depends on their own situation and why they need the hysterectomy in the first place.
All right, so we're already seeing that there's different parts to this. It's not as simple as it sounds.
Right.
But here's where it gets really interesting to me.
Mm-hmm.
What else might they take out during a hysterectomy besides the uterus?
That's a great question.
Yeah.
And it's a really important one.
Mm-hmm.
So along with the uterus, they can also remove the cervix, the ovaries, and the fallopian tubes.
Okay.
And again, it all depends on the person's situation and their specific needs.
Okay, hold on. Let's break that down a little bit, because I think for a lot of listeners, they're thinking about the uterus and they're not thinking about those other parts.
Right.
So first, let's talk about the cervix. What does the cervix even do?
Sure.
And what's the difference between having a total hysterectomy and a supracervical hysterectomy?
Okay, so the cervix is kind of like the gateway to the uterus.
Okay.
So it's the lower part of the uterus, and it connects to the vagina.
Okay.
But it does way more than just connect them.
Right.
It's like a powerful protective barrier,
Okay.
and it's super important during childbirth.
Okay.
Now, in a total hysterectomy, they remove both the uterus and the cervix. But in a supracervical hysterectomy, the uterus comes out, but the cervix stays where it is.
Oh, interesting.
Yeah.
So what happens then? What are the implications of keeping it or taking it out?
Yeah.
I mean, does it make a difference as far as your ongoing care?
Yeah, it can. One thing to remember is that if you keep your cervix, you're still going to need pap smears
Okay.
to check for cervical cancer.
Makes sense. Okay, now what about the ovaries? I know those are like hormone things, but why would they be removed during a hysterectomy?
So the ovaries are like these tiny hormone factories in your body.
Okay.
They make eggs,
Right.
but they also make really important hormones like estrogen and progesterone.
Right.
And these hormones, they don't just affect your reproductive system, they affect everything.
Right.
From your bones to your heart and even your mood.
So taking those out sounds like it could have a big impact on everything.
You're exactly right. Removing the ovaries basically puts you into early menopause.
Oh.
And that can cause things like hot flashes and trouble sleeping, and it can even increase the risk of certain health problems like osteoporosis and heart disease.
Wow.
Sometimes hormone therapy can help with these effects,
Okay.
but again, it's a choice that has potential long-term consequences that you really have to think about.
Wow. It sounds like a really big decision.
It is.
Okay, last but not least, what about the fallopian tubes?
Okay.
Why would those need to come out?
So the fallopian tubes are like these tiny highways between the ovaries and the uterus.
Mm-hmm.
They're the ones that carry the eggs from the ovaries down to where they could be fertilized.
Okay.
So one reason for removing them is to lower the risk of certain types of cancer, especially ovarian cancer.
Got it.
In some cases, they come out with the ovaries,
Okay.
and other times they might remove them on their own.
So I'm hearing that a hysterectomy can be more than just taking out the uterus.
Yeah.
It really depends on the person and what their circumstances are.
It really does. That's why it's so important to talk to your doctor. Right.
about all of these things.
Yeah.
It's about understanding what could happen
Yeah.
and making the best decision for your own body.
So it's kind of like a choose your own adventure, but with your health, which is really serious.
That's a great way to put it. You're in charge,
Yeah.
but you have to know all the info
Right.
to make the right choices.
Yeah. Now, I'm sure some of our listeners are wondering, when would a hysterectomy even be an option?
Mm-hmm.
Is it always a last resort, or are there times when it's recommended earlier?
That's a good question. A hysterectomy is usually something they think about when other treatments haven't worked,
Okay.
but it's not necessarily a last resort. It really depends on the specific problem and the person's situation.
So what kind of conditions might lead a doctor to recommend a hysterectomy?
Well, there are a lot of things. One common one is abnormal bleeding, especially if it's really heavy and it leads to anemia.
Right.
It can make you really tired and make it hard to go about your day.
Mm-hmm.
Then there are fibroids.
These are growths in the uterus that aren't cancerous, but they can cause a lot of pain and discomfort, and even heavy bleeding.
Got it.
And then there's pelvic organ prolapse.
Okay.
That's where the uterus kind of drops down into the vagina,
Oh, wow.
which can be uncomfortable and cause pressure.
So it sounds like a lot of these things can cause a lot of pain
Yeah,
and just make it hard to live your life.
for sure. And then, of course, there's cancer, precancerous cells
Right.
in the uterus or cervix.
Yeah.
And those are definitely serious situations where a hysterectomy might be the best thing to do.
Mm-hmm.
Sometimes chronic pelvic pain that hasn't gotten better with other treatments like endometriosis
Okay.
might also lead to a hysterectomy
Right.
as a way to finally get some relief.
So this is not something that people decide on lightly.
Definitely not. It's a major surgery
Yeah.
with possible long-term effects.
Right.
So it's super important to have open and honest talks with your doctor. You should feel like you can ask questions, understand all your options, the good and bad of each one, and even explore what might happen if you choose not to have a hysterectomy.
It sounds like really being your own advocate in those conversations with your doctor is super important.
It really is.
Yeah.
You have the right to ask questions, to get a second opinion,
Mm-hmm.
and to make the choice that feels right for you, even if that means saying no to a hysterectomy.
So let's say someone is thinking about it, but they're not 100% sure about a hysterectomy.
Yeah.
What can they do to feel more confident in whatever choice they make?
That's a great question.
Yeah.
First and foremost, you're the one in control, okay?
Okay.
Don't be afraid to ask your doctor for a second opinion
Mm.
or to really look into alternative treatments.
Okay.
Do your own research, read about different experiences,
Yeah.
talk to other women who have had to make similar choices.
Mm.
Knowledge is power, especially when it comes to your health.
That's so important.
Yeah.
You have the right to be totally informed and to feel good about what you decide.
Exactly. Your body, your health, your choice. You deserve to have all the information you need
Right?
to make the best possible decision for yourself.
Okay, so we've talked about what a hysterectomy is, the different types,
Right.
the reasons why someone might need one,
Mm-hmm.
and how important it is to be your own advocate.
Yep.
But let's talk about the elephant in the room.
Okay.
What's life like after a hysterectomy?
Right.
That's the part I think a lot of people are curious about.
I understand. It's a big question, and everyone's experience is going to be different,
Yeah.
depending on what's going on with them and the specifics of their surgery. But there are some common things that we can talk about that might be helpful for your listeners.
Okay, great. So are there things that a lot of people experience, like common threads or experiences?
One thing that's really important to remember is that while there are definitely changes and possible side effects, lots of women actually say they have a really positive experience after a hysterectomy
Right.
and that their quality of life actually gets better.
Okay.
And remember, they probably had the surgery to fix a health problem
Yeah.
that was causing them pain or discomfort or other issues. So once that's taken care of,
Yeah.
a lot of women find that their day-to-day life is much better.
So a lot of times the hysterectomy actually makes those original symptoms go away.
Exactly. And that can make a huge difference in how they feel overall.
I imagine there's an emotional side to all this too,
Oh, definitely.
especially when you think about maybe not being able to have kids anymore and the hormone changes that can happen.
Absolutely. It's really important to recognize and deal with the emotional side of things. If you're having a tough time, talking to a therapist or a counselor can be really helpful.
Yeah.
It's about taking care of the whole person, mind, body, and emotions,
Right.
not just the physical part.
So true.
Yeah.
Speaking of the physical stuff,
Yeah.
what about recovery? What can someone expect in those first few weeks and months after surgery?
Again, it depends on the type of hysterectomy, but
Uh,
generally you'll need to rest and take it easy while you heal.
Okay.
Your doctor will give you specific instructions on how to take care of yourself during that time.
Okay.
It's important to listen to your body and not push yourself too hard.
So just take it easy and focus on resting and getting better.
Exactly. Don't be afraid to ask for help from family and friends.
Yeah.
Let them know what you need, whether it's help with chores,
Right.
errands, or even just someone to talk to.
It's a time to take care of yourself and let others take care of you.
Definitely.
Okay, so what about long-term changes to your body?
Mm-hmm.
We talked earlier about what might happen if they take out your ovaries.
Right. So if they did remove your ovaries, you'll go through what's called a surgical menopause,
Right.
which basically means going through menopause a lot sooner than you would naturally. And this can come with some things you might not like hot flashes, vaginal dryness, and mood swings. The good news is that hormone therapy can help with those symptoms.
Oh, okay.
So talk to your doctor about whether it's right for you.
Got it. So it's good to be aware of those possible changes and have a plan for dealing with them.
Exactly. And even if they didn't remove your ovaries, a hysterectomy means no more periods,
Right.
which can be a great thing for some women.
Yeah.
But it can also take some adjusting to both
Yeah.
physically and emotionally.
It sounds like you're starting a whole new chapter in life.
That's a great way to put it. It's definitely a transition. And it's important to be patient with yourself as you navigate all those changes. And remember, there are resources to help you every step of the way.
This has been a deep dive into hysterectomies. We've covered so much already.
It really has. And, everyone's experience is going to be unique.
For sure. But so far, I think some key takeaways are that hysterectomies come in different types,
Right.
and they might take out other organs too.
Hmm.
It's something they do to treat different conditions.
Right.
But you should really think about it after you've explored other options.
Definitely. And most importantly, deciding to have a hysterectomy is a personal choice.
Yes.
You should feel like you can stand up for yourself, get all the information you need, and have open and honest conversations with your doctor
Right.
to make the best choice for your body and your life.
Here's something to think about as you continue learning about this.
Yeah.
We've talked about why someone might need a hysterectomy.
Mm,
But what about all the new medical technology out there?
right.
Is that changing the way we treat these conditions? Are there alternatives to hysterectomy that are worth checking out?
Yeah.
That's something to do some research on and talk to your doctor about. We'll get into that and wrap up our deep dive into hysterectomies after a short break.
Sounds good. That's a really good question, and one that people don't always think about. Keeping your ovaries can help you avoid those immediate symptoms of surgical menopause. But it's not a sure thing that you'll avoid all the long-term stuff.
Oh, interesting. So even if you keep them, things might not work exactly the same way.
Exactly. Even if they're still there, your ovaries might not work as well after a hysterectomy.
Hmm.
The surgery can sometimes affect the blood supply to the ovaries,
Okay.
and that can lead to your hormones gradually decreasing over time.
So it's not like you automatically skip menopause just because you kept your ovaries?
Right. You might still go through menopause just a little later than if they had been taken out. And it's really important to know the signs and symptoms of menopause
Okay.
and talk to your doctor about any changes you notice.
Okay, that makes sense. Now, what about the risk of ovarian cancer? I know that's a big worry for a lot of women. Does keeping your ovaries after a hysterectomy make you more likely to get it?
That's a common concern, and it makes sense. The good news is that having a hysterectomy itself doesn't necessarily increase your risk of getting ovarian cancer. But certain things, like a family history of ovarian cancer, or if you're genetically predisposed to it, those things can still play a role.
So those are things to definitely talk to your doctor about to see what your risks are.
Exactly. And it's so important to have regular checkups. Your doctor can keep an eye on your ovarian health and recommend any screenings or tests that you might need.
It sounds like it really depends on the person, and there's not always a simple answer.
That's true, and it can feel a little overwhelming. But one thing that's always a good idea is to be proactive about your health.
Yeah.
Do your research, ask questions, and be your own advocate.
Great advice. Okay, let's change gears a little bit and talk more about the emotional side of things. We touched on this earlier,
Yeah.
but I think it's worth diving into a little deeper. I mean, a hysterectomy is a major life event.
Mm-hmm.
It's going to have an emotional impact.
It definitely can. A hysterectomy can be a very emotional experience.
Right.
Even if it was medically necessary and it helps with those symptoms, it can still be tough. There can be feelings of loss and grief and even changes in how you see yourself as a woman.
I can imagine that not being able to have children anymore can be especially difficult for some women, even if they weren't planning on having more kids. It's like a door closing, you know?
It is, and it's different for everyone. Some women might feel sad, angry, or even guilty. It's important to let yourself feel those emotions and not try to push them down.
So how can women deal with these feelings and find a way to move on?
Well, first of all, it's really important to acknowledge and validate those feelings.
Okay.
Don't try to pretend they're not there. Talking to a therapist or a counselor can be incredibly helpful
Right.
in processing those emotions and finding healthy ways to cope.
What about support groups? Do you find those helpful?
Absolutely. Connecting with other women who've been through a hysterectomy can be so powerful. It makes you feel like you're part of a community, like you're understood. You can share how you're feeling, ask questions, get advice, and realize that you're not going through this alone.
There's something so comforting about knowing you're not the only one.
Exactly. It can make a huge difference.
We've talked about the physical and emotional stuff, but I'm also curious about the more practical side of things.
Yeah.
What are some tips for just navigating daily life during recovery? I mean, it's a big surgery, so I imagine there are some changes you have to make.
That's a good point. The recovery period is different for everyone,
Right.
but generally, it's really important to listen to your body and give yourself the time you need to heal.
Oh,
Avoid anything strenuous, like lifting heavy things,
Mhm.
and no sex until your doctor says it's okay.
So it's all about slowing down and focusing on healing.
Exactly. This is the time to rest, recharge, and let your body do its thing. And don't be afraid to ask for help from loved ones. Tell them what you need, whether it's help with chores, errands, meals, or just someone to keep you company.
It's a time to let people take care of you.
Exactly. And remember, everyone recovers at their own pace.
Right.
Don't compare yourself to others or feel like you have to rush things.
Patience is key.
It really is. And if anything feels off or you have any concerns during your recovery,
Yeah.
don't hesitate to call your doctor.
Good advice. Okay, so we've covered a lot today, from the medical details of hysterectomies to the emotional and practical parts of recovery.
We have.
But I think it's important to end this part of our deep dive on a positive note.
I agree.
While a hysterectomy is a big change, it doesn't have to be the end of the world. A lot of times, it's a new beginning.
That's so important. Many women find that they not only recover physically, but also feel much better overall.
Because the health problems that led to the hysterectomy are gone, and they can finally move on.
Exactly. It's a chance to start a new chapter in life, one that can be full of joy, fulfillment, and new possibilities.
It's about adapting and finding a new normal.
Absolutely. And remember, you are not alone. There are resources available, people you can lean on, and a whole community of women who have been through similar things and come out stronger.
This has been such a great conversation. I think we've given our listeners a lot to think about and discuss with their doctors.
I agree. Knowledge is power, and being informed is the first step toward making decisions about your health that you feel good about.
Absolutely.
Hmm?
And here's one last thing to consider as you keep learning about this. We've talked about the different reasons why someone might need a hysterectomy.
Mm-hmm.
But what about all the advancements in medical technology? Are there new options out there that are changing the way we treat these conditions? Are there alternatives to hysterectomy that might be worth looking into? That's something to research and talk to your doctor about. We'll explore that and wrap up our deep dive into hysterectomies after a short break. So before the break, we were talking about all the new stuff in medical technology.
Right.
It seems like things in medicine are always changing, so I'm curious, what's new in treating the conditions that might lead to a hysterectomy? Are there other options out there that women should be aware of?
Yeah, definitely. Medical technology is always moving forward, and there are some really exciting things happening that give us alternatives to hysterectomy, especially for things like fibroids and endometriosis.
Oh, cool. Like what kind of new things should people be thinking about?
Well, one area where we've seen big progress is minimally invasive procedures. We talked before about laparoscopic and robot-assisted hysterectomies,
Right.
but they're using these same techniques for other gynecological procedures now.
Okay.
And that can help some women completely avoid a hysterectomy.
So they can just target the problem, like fibroids, instead of taking out the whole uterus.
Exactly. And that can make a huge difference for women who want to have kids later.
Right.
Or who just want to avoid a bigger surgery like a hysterectomy.
Wow, that's amazing.
Hmm.
Are there any other minimally invasive things out there that are making a big difference?
Yeah, another one that looks really promising is uterine artery embolization.
Uterine artery embolization?
Yeah. Have you heard of it?
I haven't. Tell me more.
It's pretty amazing, actually. It's a procedure where they block the blood vessels that feed the fibroids, so they basically cut off their food supply.
Wow.
and that makes the fibroids shrink. It's way less invasive than surgery and can be a great option for women who aren't good candidates for surgery
Okay.
or who want to avoid a long recovery.
So it's like they're starving the fibroids.
Exactly. And it's turning out to be really effective for a lot of women. Then there are other options too, like endometrial ablation.
Okay.
That's a procedure where they take out the lining of the uterus.
Okay.
It can help women who have heavy bleeding.
So it sounds like there are a lot of minimally invasive procedures that can be used to treat these conditions, and maybe a woman won't even need a hysterectomy.
Exactly. And on top of all these new procedures, there have also been some big improvements in medications.
Oh, really?
For example, there are medicines now that can help control heavy periods by adjusting hormones
Okay.
or by targeting specific things involved in blood clotting.
Wow. So many options. It's not like it used to be when a hysterectomy was the only answer.
Not at all. It's not a one-size-fits-all situation anymore. There are so many ways to treat these problems now, and the best option really depends on each woman and what she needs and what her goals are.
It sounds like the key is to really talk to your doctor about all these options, both the surgical and non-surgical ones.
Absolutely. It's all about having all the information and picking what feels right for you. Your doctor can help you weigh the pros and cons of each approach
Right.
and help you make the best decision for your specific situation.
So even if a hysterectomy was recommended before, it's worth talking to your doctor again and seeing if there are new options now.
I think that's a great idea. The more you know, the better. Medicine is always changing, so stay curious, stay informed, and don't be afraid to ask your doctor about new things that might help you.
This has been such an insightful conversation. I think we've given our listeners a lot to think about.
I hope so.
We've covered so much, from the types of hysterectomies to what it's like after surgery and all the new alternatives that are available now.
It's been great sharing this information with your listeners. Hopefully, they'll feel more confident in making decisions about their health.
Absolutely. Remember, you are your own best advocate. Ask questions, do your research, and if something doesn't feel right, get a second opinion. There are lots of resources and people out there to help you along the way.
That's right, and you're not alone. Lots of other women have had to make these decisions, and they've come out stronger on the other side.
So as we wrap up our deep dive on hysterectomies, I want to leave our listeners with one last thought. We've talked about the physical and emotional effects of a hysterectomy, but what about how society and our culture view this procedure? How do those perceptions affect women's choices and their experiences? That's something to think about and maybe even talk about with the people you're close to. Until next time, keep learning and stay curious.